I'm sorry, could I have an answer to my question?
One simple question brought this hearing to a standstill, and Senator Elizabeth Warren wasn't willing to move on without an answer. The dispute centers on a Pentagon healthcare contract that serves roughly 9 million service members, veterans, and military families. Warren argues that the company managing the program may have a built-in conflict of interest, one that could affect both taxpayer dollars and access to prescription drugs. When she asked whether the Department of Defense was concerned, the answer she received wasn't the answer she was looking for.
Are you concerned that Express Scripts appears to be steering service members to the pharmacies that it owns and overcharging American taxpayers?
Thank you, Ranking Member Warren. I appreciate your support, and I understand that this is an important issue. The department continues to look at this and review, and as you're aware, this PBM TRICARE PBM is different than a normal PBM. It provides administrative services only. It's a contract management mechanism for the departments. It does claims, mail order pharmacy, and is paid a fixed fee for each of the prescriptions. The Department of War controls their pricing and retains the cost savings. We understand the concerns, and we welcome the opportunity to work with you and your staff.
I'm sorry, could I have an answer to my question?
At the heart of Warren's argument is a simple concern. What happens when the company helping manage payments also competes for business itself? Warren points to two warning signs. First, reports suggesting significantly higher costs for some generic prescriptions. Second, the departure of thousands of pharmacies from the network in recent years. Supporters of pharmacy benefit managers argue they help control costs and streamline prescription services. Critics contend that when one company plays multiple roles inside the same system, transparency becomes essential. The next exchange focuses on whether those concerns are being taken seriously.
You've had 20 years to think about this.
The department continues to evaluate this budget. It reviews and works with the contractor to ensure that it's within the guidelines of the contract.
Well, you're working with the contractor. How's that working out? How do you explain $484 on average more for prescription for generic drugs?
Thank you, Senator. I'm not aware of the cost discrepancy.
Okay, then how do you explain 13,000 pharmacies actually leaving the whole system, just saying, you won't even pay me enough to make it worthwhile?
The contractor is meeting its contractual requirements.
Yeah, what? What are you saying about 13,000 pharmacies leaving this whole system, and they won't do they can't fill prescriptions now for our military and for our veterans? You're okay with that?
This is where the discussion shifts from healthcare policy to accountability. In congressional oversight hearings, lawmakers often want a direct answer to a straightforward question. Is there a problem or isn't there? Government officials, however, frequently respond more cautiously, especially when contracts, audits, and ongoing reviews are involved. That difference can create frustration on both sides, and it raises a larger question. If concerns about this system have existed for years, why are lawmakers still struggling to get clear answers today?
No, ma'am. Our priority is to make sure all of our beneficiaries, the 9.6 million, get the coverage that they deserve and the benefits they deserve.
Well, I think they deserve a lot more than what you're delivering for them, and I want to know when you're going to get better at this. Look, what we're talking about here is a blatant conflict of interest. Our job in this Senate subcommittee is oversight. And that's why it is, for years now, I've been calling for more transparency to ensure that Express Scripts isn't favoring itself and its own subsidiaries and under-reimbursing the independent pharmacies in the hopes that it can drive them out of the TRICARE business altogether and just have more of the business for themselves. I have been met with obstruction every step of the way from our own Department of Defense. So let me ask you another question, Secretary Bass. Will you disclose the differences between TRICARE reimbursement rates and fees and other price concessions between what it's paying pharmacies and what it's paying itself?
Yeah, thank you, Ranking Member Warren. I commit to working with you and your staff in providing the data that
You'll give me that data.
I will work with you and your staff.
I'm going to hold you to that.
For Warren, Pricing is only part of the issue. The larger battle is transparency. If Congress cannot review the underlying data, reimbursement rates, and audit findings, lawmakers argue it becomes much harder to determine whether taxpayer dollars are being spent efficiently. Pentagon officials maintain that oversight mechanisms already exist and that contractors are meeting contractual requirements. Warren believes greater disclosure is necessary before Congress can independently verify those claims. The exchange that follows centers on whether lawmakers will gain access to that information.
So, Express Scripts' pattern of bad behavior speaks for itself. In addition to the news reports that I've already mentioned, an audit by the Office of Inspector General for the Office of Personnel Management found that Express Scripts overcharged American Postal Workers Union and the Federal Employees Health Benefits Program by about $45 million. And the Government Accountability Office found, quote, persistent inconsistencies in the data that Express Scripts provided to DOD, which DOD is supposed to be validating on its own, but failed to catch. So, Secretary Bass, given the long history of infractions by Express Scripts that I just read to you, will you commit to annual audits of the TRICARE pharmacy contract to ensure that taxpayer dollars are not being wasted?
I commit to, yes, I commit to doing annual review of the contract.
Good. And then will you let us see those annual audits?
I commit to working with you and your
No,
staff.
will you let us see them? I don't want to hear about them and hear your summary. I want to see the audits. Do I have that commitment?
I will work with you and your staff.
Is that a yes?
Yes.
Good. Thank you. That wasn't so bad. Thank you, Mr. Chairman. I apologize for running over. I just want to finish up by saying the current TRICARE contract with Express Scripts expires in 2029, and DOD right now is in the acquisition planning phase for the next generation contract. As it builds the requirements for this new contract, DOD cannot continue to ignore this conflict of interest that arises when a company owns both a PBM, that is the one directing the payments, and a pharmacy. That has got to stop. And in the meantime, existing contracts should be regularly audited and subjected to much greater transparency to try to beat this kind of conflict out of the system. I look forward to working with DOD on this and serving the best interests of the 9 million American service members, veterans, and their families who are depending on us. Thank you. I appreciate it, Secretary Bass. Thank you, Mr. Chairman, and thank you for the extra time.
What began as a discussion about prescription drug contracts ultimately became a debate about transparency, oversight, and public accountability. Senator Warren argues that a company should not be allowed to oversee key aspects of a system while simultaneously competing within it without stronger safeguards and scrutiny. Pentagon officials maintain that existing contract requirements are being followed and that review processes remain in place. What remains unresolved is whether those safeguards are enough or whether additional transparency and auditing are necessary to reassure military families, healthcare providers, and taxpayers alike. What do you think? Was Warren right to demand more direct answers, or were Pentagon officials appropriately cautious in their responses? If you enjoy balanced political analysis and coverage of major policy debates, don't forget to like, subscribe, and turn on notifications for future videos.